Hi, Dr. Paul. I'd like to respond to all the questions I get. Someone asked me the difference between anxiety, stress, and burnout. So that's a good question. A lot of subtlety with that question, actually, because, well, burnout's burnout. So burnout is if we, working way too many hours, just stress to the max, working in a stressful job that just gets to you after a while. So burnout can happen. People, again, not having enough time off, working weekends. And so a lot of people just work way too much and they get burnt out. And I have a lot of patients that see me that I just can't do this anymore. And then sometimes they go on disability for a while because they just can't, But so burnout's burnout. There could be a sign of an underlying clinical problem there, but I would have to assess the patient to know that. Or is it just the burnout, right? Or is there something else underlying? Stress is stress. I mean, we all feel stress at times. I separate it into good stress and bad stress. What's good stress? Good stress is getting a promotion at work. Good stress is having a child, but then they're changes your life and they're not cheap. There's a lot of good stressors, getting a promotion at work, moving to a bigger house, the dream house that you've been saving up for. And so all these are great things, but they're stressful because moving is stressful. As anyone who's moved, which I'm sure everyone has, it's not easy to move. There's a lot to do, and there's way more than you think there's to do when you move, especially if you've been in a place for a long time. So there's certain things that just cause stress, and that's normal. But then you recover from it and you're fine. Now, an anxiety disorder is different. So if you have what we call a clinical condition, like an anxiety disorder, it can be a generalized anxiety, which means you're kind of just anxious all the time. There could be social anxiety disorder where you just really get anxious around other people and strangers. There's different kinds of anxiety. There's phobias. There's, the anxiety about flying, about public speaking, the common. But anxiety disorders are really more if it affects your life, and if it gets to where you're feeling like I'm just not myself. I never used to feel so anxious all the time. This is just not me. So I try to get to a baseline of the person. Try to figure out, okay, what's your baseline? When did you feel your best in your life? I start there with, let's go back. Tell me about when you felt your best, and when did that change and why? So I basically to just take a really detailed history to try to figure out when things started, how they progress over time, and is it clinical at this point? Is it affecting their lives? Are they not sleeping well now? They're having body aches and pains. They're not focusing well at work now. They're not sleeping well at night. They're tired because they're not sleeping. So it can cascade into a myriad of different symptoms and problems that people have. Now that's clinical. And the same thing with depression, which we'll do depression on a different video, but that's the basics. And anxiety, it happens to be the number one thing I see in my office. The number one symptom I see in my office is anxiety. Number two is depression, because anxiety is more common. It brings people in more because people will actually be depressed longer than they'll be anxious, because being anxious gives you the physical things. And the other reason it's an anxiety disorder if you get the physical symptoms like the racing heart, the shaking, the shortness of breath, the sweating, so these are like we're having like a panic attack where I can't breathe. So a lot of people go to the emergency room in that situation because they think they're dying. They think they're going to stop breathing, or they're having a heart attack or whatever. And then they end up spending a lot of time and money in the ER and then get discharged with basically nothing. And they say everything's fine. Well, what do you mean everything's fine? I feel terrible. Well, it's nothing we can test for with it's a history thing. It's a clinical thing. And so that's kind of how I know to address it. And normally when people come to my office, it's gotten to the point where it's affecting them, and that's why they're seeing me in the first place. And so, so I talk to them about counseling when needed. Of course, exercise is very important when you have anxiety. You want to be on a regular exercise program if we can. That can help. Learning breathing techniques, learning how to relax. So yoga, meditation can be helpful. Learning how to breathe through your anxiety. So there's ways and things, the tools I give to patients to deal with anxiety. But again, it's something that's treatable and it's medically treated. And again, if you feel like, oh, that doesn't sound right to treat it, well, I'm sorry, but it is right. The treatment works. It resolves the anxiety. It gets them back to their baseline. It gets them back to normal. So that's the goal with treatment, of getting people back to normal.